Hello, I'm Jordan Greenbaum, and for the next few minutes, I'd like to talk about the impact of trauma on physical and mental health. While this webinar is created specifically for Project Lifeline's Predicate Order Resource Center, really the information has relevance for lawyers who are interviewing traumatized children who are seeking other legal remedies. And that may be asylum seeking or withholding of removal, but it really has broad implications. Many migrant children experience significant and complex trauma before, during, and after immigration. Poverty, physical or sexual abuse, sexual assault, community violence, or loss of loved ones may precipitate the migration, and deprivation, stress, and violence may occur during the journey to the United States. Once the child has entered the U.S., further trauma may be experienced in the form of strained interpersonal relationships, stress related to immigration status, financial stress, violence and exploitation, and xenophobia. Depending on the source, trauma and stress may result in physical adversity, including malnutrition or significant weight loss. It's related to food shortages or forced deprivation. Infection, especially sexually transmitted infections that are related to sexual violence, and communicable diseases associated with crowded and unsanitary living conditions, or poor general health and untreated chronic diseases, exhaustion, chronic pain such as headaches, back and stomach aches, injuries and associated sequelae, and unwanted pregnancy associated with sexual exploitation, for example. Any of these issues may impair the child's ability to engage with you and focus during your interview. Medical care, including an initial evaluation and ongoing longitudinal care, are critical aspects of the holistic approach to child migrant services. Traumatized children may experience nightmares and insomnia, as well as increases or decreases in appetite. But beyond the immediate and the long-term physical adversity, trauma experienced by migrant children can lead to significant emotional and behavioral health challenges. Children may manifest their trauma in various ways, some of them associated with their developmental stage. For example, younger children may show developmental regression. They may resume early behaviors, such as bedwetting, that they gave up long ago. They may be reluctant to separate from caregivers, or may become easily frustrated and angry. Children of all ages may demonstrate signs and symptoms of post-traumatic stress disorder, and this includes things like avoidance of certain people or situations, dissociation, so you feel like you're standing outside of yourself or not really in the situation where your body is. Feelings of numbness or anxiety and panic. Others may experience severe depression and social withdrawal, even suicidality and self-harm behaviors such as cutting. Migrant children may react to their prior experiences of fright and loss of control by becoming hypervigilant to their surroundings, easily aroused by external stimuli. They may experience difficulties with memory regarding trauma events and problems focusing on your questions. Their behavior may be inattentive, their emotions labile, or their affect uniformly flat. Keep in mind that behaviors generally serve a function, and the child's behaviors may reflect their adaptation to a very hostile, unpredictable, and dangerous world. They may use aggression to protect themselves from others, sexualized behavior to communicate with others, withdrawal to minimize the impact of their presence in the environment. If you can understand these behaviors as adaptations to trauma and manifestations of traumatic stress, it's much easier for you to give an empathic, non-judgmental, open response. Given the frequency of depression and distress among traumatized children and youth, you need to be alert to ideas and plans that are centering on self-harm and harm to others. Current thoughts and plans of aggression toward the self or someone else call for immediate psychiatric evaluation to ensure the safety of the child and those around them. I hope this information on the health impact of trauma is helpful to you in your work with migrant children and their caregivers. The more you know about the general effects of traumatic experiences, the easier it is to help provide a holistic response that meets all the needs of the child. Thank you so very much for listening.